I cordially invite teacher trainee Shiromi Dandenya to introduce our next guest speaker in this conference.
Thank you very much. Thank you very much, sir. Hello, and a very good afternoon to all of you. I'm proudly delighted that I got this opportunity to welcome the guest speaker of this session. And she's none other than Ms. Surena Gurung. Ms. Surena is the principal of Galaxy Public School of Nepal, which is one of the topmost schools in Kathmandu. She's a reputed principal and a senior lecturer. Today, Ms. Surena will enlighten us with special education, their nutrition, good health, and care. So, my dear guests, please welcome Ms. Surena Gurung. Over to you, ma'am. Thank you.
So, good afternoon, everybody. It's a privilege for a Nepal team. And Nepal team includes Kalpana Basnetji and me, myself. And it's a privilege that, that we have given a platform for participating in a South Asian countries conference we are having today. And it's a privilege to participate, especially in terms of understanding quality education in terms of sustainable development goals, which has been set aside by the United Nations. And today we are here, a team of Kalpana ji and me, myself. Before starting off with Kalpana Basnetji's presentation, I would like to acknowledge the Ministry of Education of Sri Lanka, along with Kamala Janaka Kamalgoda ji for arranging such a wonderful platform where, you know, education enthusiasts from around the world can come together and discuss upon a very importance of quality education for our children. And it is also a happy Children's Day to children of Sri Lanka. And there's a lot of challenges in terms of early childhood education or in terms of implementing educational program in our country as well. Over the last 20 years, Nepal has made a significant progress in education, but the net enrollment rate in primary schools has risen to 97%. However, the country still has many challenges to tackle in the future. And the issue that persists in education includes poor quality and inequality in access, geographical remoteness, gender and socioeconomic and ethnic differences. Key barriers to enrollment and attendance include poverty, social inclusion, disability, migration, child labor, and social norms and gender bias that is still in practice in some amount. We have about 7,70,000 children aged between 5 to 12 years of age are still out of school. This is the data which has been taken from UNICEF Nepal. Only half of the students in grade 3, 5, and 8 meet the academic achievements criteria for Nepali and mathematics. Attendance in early childhood education, ECE, is still low at 51%. There is inequality in education sector as only 12% of the children from the lowest wealthy are developmentally on track in illiteracy and innumeracy compared to 65% from the highest, wealthiest quantity. Very few schools meet child-friendly school standards. This is another challenges that Nepal faces. And only 11% of the school buildings are earthquake resistant. And in terms of talking about earthquake, falls under the two tectonic plate, Indian plate and Tibetan plate. So it's a frequent that Nepal suffers from earthquake from time to time. And another thing that we faced a lot of challenge in the recent years is due to COVID-19. That is, because of COVID-19, there are a lot of schools, of government schools, children who have been deprived of quality education, especially face-to-face education that we call it. And although online education is sought as an alternative to face-to-face teaching and learning, During crises like COVID-19 pandemic, its availability and accessibility and practicality are questionable in the context of Nepal. And I believe it's the same thing in terms of South Asian nations. Schools, colleges, and universities remained closed immediately after the announcement of the lockdown last year. And this year, we are facing our second lockdown stage. And in the second lockdown stage, though the percentage of students attending online classes have increased in a lot of ways, but then also there are a lot of students who are in the remote villages who have no access towards such kind of education. And this year, basically, even the government schools, basically, because of lack of infrastructure, they were especially devoid, but rather compared to government school, the private schools had implemented vigorously all the curriculum, education material to the students in terms of educating through remote learning. That is how we have done it. And including our school, which happened to be a private school, have done the virtual classes successfully in the second lockdown stage though. But the schools of Nepal are slowly opening from this month. And from next month onwards, I think majority of the big school and small school all would have opened with following standard measurement regarding health issues, like, for example, wearing masks, keeping distances. So that is also in terms of, students, it is questionable to me, okay? There are a lot of opinions from different people, but then having a child sit inside with 30 along student inside a classroom, it is questionable, especially when the children are not vaccinated. And only if the teachers are only vaccinated and the administrative staffs are vaccinated, it doesn't mean that we are quite ready to fight against COVID-19 at this moment. So it is a lot of challenge in the coming year, coming month, we might be facing in the coming month while operating school face-to-face. So without, after sharing all these things, what's happening in terms of education in Nepal, it is my privilege for me to introduce you all Mrs. Kamala Basnetji, who is a more expert and expertise and she has more experience in terms of especially working in terms of special childhood education. So I would like to introduce Kamala Basnetji. She's here with us. She has done, let me give a brief introduction about her. She has done master's degree in pediatric physiotherapist, specializing in early intervention and rehabilitation of children with physical disabilities, and have done bachelor's and master's degree from Rajiv Gandhi University, India. And she has further done a lot of trainings, advanced training, especially in functional intensive training of children with cerebral palsy in Maastricht University, the Netherlands. And she is a founder and managing director of Special Education and Rehabilitation Center, SERC Pediatrics Therapy Center, which is located in Lalitpur. And recently, to inform everyone, her center, rehabilitation center, was in trouble in the past couple of months because of the heavy rainfall and monsoon. It lies near the river, and the river, it flooded all of a sudden. And she's going to share more of her experience herself. And the rehabilitation center was totally devastated with the flood. And even though it happened last month, she's here strong and willful to share her experience with every one of us. So also, to add to her resume, I would like to say at one point she held practicing license for physical therapy in state of Michigan, USA, working in the areas of disability management, rehabilitation of children living with disabilities for the past 17 years. And she has become an internship mentor of bachelor's and master's candidate of physical therapy of Laval University, Queen's University, Canada, Maastricht University, and Zuid University of the Netherlands, University of Salzburg, Austria, and of course, our very own Kathmandu University, which is situated in Nepal. So she is also the instructor of wheelchair courses and functional intensive training for children with cerebral palsy. So I would like to call upon Kalpana Basneji to present her presentation to the entire team of international team of South Asian Conference. Thank you. Kalpana ji, over to you.
Thank you. Good afternoon and namaste to all. So first of all, I'd like to respect dear ministers of education in Sri Lanka, ministers, all ministers, and then the honorable members of South Asia International Association for Early Childhood Care and Development, directors and all others members of the NITA, and all other distinguished participants and all other teachers, students, and ECD officers in Sri Lanka and South Asian region. Today is a very special day of Saya for ECCD. So I would also like to thank you, Janakaji and Surinaji, for giving such a golden opportunity to share my experience and to share what's services available for the children with disabilities in Nepal. So thank you. So I'm going to present on the my presentation. I would like to share the most of the services that is available in Nepal. So during this presentation, I'm going to share the services available in our center, so which will tell or give brief introduction or brief ideas for you all. What are the services that already exists in Nepal? So in Nepal, as the Surinaji said, it's a very difficult situation in Nepal. Our Nepal is also going on how to provide a quality education for the normal child, able child. So there is a huge problem for the services that is needed for Nepal for special needs children. Regarding the disabilities, I think in most of the remote part of Nepal, we said like still in some part they said it's superstition. Maybe they did some bad karma in past, that's why they have a child with disabilities. But nowadays, as people are more educated, more aware, so now the people realize like the children should need a service. They should have children with disabilities should have rights to go education, rights to go for rehabilitation, rights to go for events and all. So this is slowly going on awareness in most of part of Nepal, but lots of development is needed. So now I'm going on my presentation on what type of schools that is available in Nepal. So there are different types of educational institutions providing special education established under the different policy and education frameworks in Nepal. So we have a school only for intellectual disabilities, school for hearing impaired, and school for visually impaired. We have an integrated school. Integrated school is like we have a mainstream school in most of like 3 years back, it's recorded that 350 school in most of the districts of Nepal. In that school, like mainstream school, have one classrooms and one accommodation for the children with disabilities. So children can stay for the 10 months. Because in village, you know, the geographical barriers we have in Nepal that Surinaji already told, like some have to walk 10 days, 5 days, 4 days to reach to the center. So then our government says those who have to walk a lot, they can stay in the resident services. So student with disabilities can stay in research center for the 10 months. All the like costing for accommodations, teacher, all the administrative, all are covered by our government in this resource center. It is purely run by the governments. And there are like institutional based rehabilitation center, which is supported and run by the INGOs and NGOs, like daycare center for autistic children, daycare for children with Down syndrome, center for muscular dystrophy, different types of daycare centers, and different types of rehabilitation centers. So regarding like special education, I like to share how we started special education and rehabilitation center in Nepal. In 2009, some people, including me, like before I used to work with the international organization, and I visited a different organization in different parts of Nepal. Then what we see like concern that the children are receiving not receiving a proper rehabilitation treatment along with the education they needed. So at that time, all the institutions are either an educational institution or a rehabilitation center. So if the child goes to education, he will miss the treatment. So maybe they have to go once in a week or twice a week in a clinic to take a rehabilitation. So if the child goes regular to a rehabilitation center, like for the therapies clinic providing the therapies, so they miss the education. So then we thought we need to have a center which is provided both education and rehabilitation in the same row. So in 2009, we started the Special Education and Rehabilitation Center for Disabled Children, with the objective of providing quality education and rehabilitation services for the children living with physical and intellectual disabilities under the one roof, with the Special Education Policy 1996 of the Government of Nepal. So fundamental of SCRC is institution has to integrate education and rehabilitation services into a single program and provide both these services under a one roof. So every organization who runs with the special educations, they have their own objectives. So our objectives is provide the comprehensive education and rehabilitation services to the children with disabilities, providing independence and quality of life of children with disabilities, providing special education according to the IQ, learning abilities, and intellectual capacities, providing support and coordinating as a resource center to the government and other institutions for the development of special education in Nepal. So as Surin, as I said, I have a training. I got the opportunity to visit to USA, UK, and Netherlands, and saw how their school is running, curriculum, and everything. So not every centers in Nepal have opportunity to go to the abroad and learn. So we in SCRC, we like to make our center as a resource. So we like to show the people how to work with the children with disabilities. So then they don't need to go to the abroad if because they can't get opportunity, and then they can see how the special children can handle. So in SCRC, we're also designing, developing, and implementing various curriculum, education material, and adaptive devices for children with disabilities, establishing and operating a sustainable scholarship program to support for the children with disabilities who are economically disadvantaged. So, you know, we have lots of barriers in the village and mountain, lots of poor people, like they have a difficulty to survive. So it's very difficulty to get a services, rehabilitation services. So in SCRC, we have some scholarship fund. So we provided for those children who need it. And we also provided, our objective is also providing a counseling to parents of the children with disabilities and advocate for the rights of children with disabilities. So in that, I'll just focus on how we look, because in the village, even the parents don't know how to have a disability card. They didn't go to their government office and tell, I have a disabled child. They are not aware what are services already available in village. So in SCRC, we have a booklet that is developed by a disabled association, and a lot of more aware about the what are the services available for disabled children in all over the Nepal. So if the parents children with parents come with the children, so we'll focus them, did you go to the government office, did you make a disability card, did you tell the government that you have a disabled child, did you know the services available in country, because as our office is in Kathmandu, school is in Lalitpur. To come to the Kathmandu stay, it's very expensive. It's very difficult. So it's nice to have parents aware about the disability card and all. So regarding the disability card, we have three types of disability card, like red, blue and white. Certainly in this year, our government has increases the allowances. So according to the card, the children will get allowances. So that allowances will get by the parents in the children banks. So parents can use that money for the children's services, educations, or the health, and then the rehabilitation services. Apart from that, we also advocate the parents for the rights of children. Like if you have a disability card, what the child will get benefit, like benefit for health services, benefit for transportations, all this we advocate for the parents. So every organization have a enrollment process for the children with disabilities. So in SCRC, we have a basic protocol for the enrollment. So we have a baseline assessment in which we assess the holistic development of the child. So we assess in 6 areas like communication, self-care, sensory integration, cognitive skill, physical function, mobility, and socialization. So this baseline form was developed in 2010 by me from the different administrative procedure or checklist used by the special needs school in UK, USA, and early childhood POTES guidelines, some sensory checklist, sensory self-care independence skills. And this was modified according to our Nepali cultures, cultures, and then food, everything. And communicate after this assessment. We communicate with the parents the option, condition, level, and activities they can do at home and school. So it's not compulsory that every child should be admitted in our SCRC. I already told you that there are a lot of barriers, problems for those who came from the mountains, village, and all. So there we have to say that this is a center available in village. You have to make a card, then you'll get money. You have to do this activities at home and come after 3 months, or call me like this. We just do to the parents, and also communicate about the prognosis and time frame. So you all knows, like the children with the parents have some have very high expectation. We have to give a clear idea, because if the child is very severe, they wants to have their child to work within 1 year. So we have to clearly say that maybe your child needs to foresee it, and this you have to do it. We have to say clearly what is the prognosis. And sometimes we have to counsel the parents, like if child is very bright with low severity, but the parents don't want to send the child to the school. All we have to say, he have this type of disability, he can do a better progress, he can do education, he can be independent in life. So you have to send the children to the schools. And we in SERC, most of the school now works on the client center than the therapist needs. So now the approaches is changed. Before, like when the patient comes, we will see with our eyes and we say, okay, this child had this problem. This child's hand is like this. He didn't walk, so I have to improve his hand and maybe makes walk. So now we looks to the parents' needs and child needs. What the parents wants. Maybe he wants his child to be independent in eating or dressing or socializing or behavior. So now we use a Canadian occupational performance measure set, which is one of the toolkit we can use to find out the needs of parents. So we find out the needs of parents, and according to that, we make interventions, goals, and activities. So after every 3 months, like in mainstream school, you have a test, terminal exam like that. But in special schools, we have a 3 months achievement reports, which will have activities, what they achieves, what is the next plan, and what are the activities. And while making a new plan, we have to focus on the clients and the parents. There is a criteria is like, if the child is above 8 years or 10 years, he can speak well, a good intelligence. So we can ask the children what he needs for 3 months. Or if the child is non-verbal, low IQ, then we ask the parents what they need and we make a plan. So this is a very satisfactory work. So parents says, okay, my needs is this one. They are working on this, but we all have to work this in the multidisciplinary approach. Parents is the main key person to work for the development of child. So parents, have to do. So in activities, we say this you have to do. If the, like, for example, child have to be independent in eating. Like in normal mainstream school, we think the child have to learn the curriculum, he have to pass, he have to get this much grade, this. So when we look for the special needs children with cerebral palsy, Down syndrome, autism, we look more, education is more how to make them independent. So if eating, then we'll tell the parents this you have to make, maybe lunch will focus, train how to eat, and then you have to focus on dinner. So both have to work together to achieve the goals. So these are the services we provided. So in education, we have a special education, mainstream education, cognitive development therapies, early childhood and Montessori education, vocational training, all daily living activities training, and training to the parents. And in rehabilitation parts, we have a early functional intensive therapy, physiotherapy, music therapy, speech therapy, and multisensory therapies, and manufacture of devices for postural management, care, support, and adapted equipment. So in education, so I'm just giving ideas, like you all knows what are the services that already available in Nepal. So in SERC, we have categorized the classroom according to IQ, is an educational requirement, learning abilities, and cognitive skills. So we have a total 6 classroom. Edelweiss class, we give all the classrooms with the flowers. So children are like flowers, so we give a flower's name. So in Edelweiss class, we have a 3 to 6 year child with the cerebral palsy, autism, Down syndrome. So in this is most of the parents' needs is maybe child can eat independently, drink independently, goes to toilet or sign for toilet, or in cognitive development, maybe if some of you works with the special needs children, some special needs children with low IQ, they even don't know what is like ball, spoon, they didn't recognize also. We focus on cognitive development. And in Lotus class it's 6 to 8 years. So in this we have a child with physical problem, mostly child with cerebral palsy. So they have a very bright brain, but they cannot go to the mainstream school because of their toileting problem. They can't walk, but their brain is very bright. So we focus them on early childhood development and pre-primary education. And in Larikuras, we have a children with 8 to 10 years. So this child is mostly with the autism and ADHD, attention deficit hyperactivity disorder. So this child we focus on, I already said it's a different education system for mainstream and special education, because child is 8 years, maybe his brain is like 6 months or 1 year. So our main learning, giving education is to be independent in life. So that's why in Lalikuras we focus on ideal, drinking, toileting, bathing, brushing and all, and cognitive development and behavioral management. And in Sunflower class, this is a very bright class. It's 8 to 14 years. In this classroom, we have a student that is not get or rejected from the mainstream school, or the child is in the mainstream school in lower kindergarten. For 3 years he is in lower kindergarten. Some may get upgraded, like maybe he will be in 3rd grade, but his brain is like lower kindergarten. So in that, we have mostly in this classroom, the students are from mainstream school. So in this, we focus on what the child have problems, because once you realize the child's difficulties, problems, and focus according to that, they can do a mainstream education. We already, 2 of our students already passed the SEE. Now 2 are doing in 6th grade. So if we give and deal them, understand them correctly, we can make them education also. So in this type of, in this Sunflower class, we have mostly children with slow learner, like dysgraphia, dyscalculia, and dyslexia. So you all know, like dysgraphia is a child knows all the spelling, everything, calendar, all. If you ask spelling, question answer, he answer. But he have problem on writing planning. So he is very difficult on writing. And in dyslexia, he knows how to write and all, but he have difficulty in articulating and processing, talking, like communication. And in dyscalculia, he may be good in English, he may be good in Nepali, all, but he have problems with number and calculation. So this type of students are enrolled in the Sunflower class. And we in the Rose class, we have 8 to 16 years, mostly the girls. So in this, we focus on adult informal education and basic skills. So in our government of special education also have developed some checklist for the life skills, like what we have to focus. It is in our Nepali language. We also include that. But so we focus on life skills, and they are the girls. So we also give the education on menstruation, hygiene, sanitation, and even boundaries. So according to our countries, we have certain boundaries to have with the strangers, boys and all. Even we also give them education about the girls' problem issues, what are the boundaries, or if some harassment or something, they have to inform to the teachers which part to touch. All these awareness things we give to the Rose class. And in Lalupati class, we have children with 14 to 18 years. So in that, we have mostly male and some are girls. So we focus on adult informal education and life skills. So some of the pictures of the classrooms. And in rehabilitation department, we have a physiotherapy. So we focus mostly with the children with physical problem for physical function and mobility, like crawling, walking, sitting, stair climbing, going to a room like that. And in gym, we focus on fitness, aerobic, group games, and exercise. In this, mostly the children with intellectual disabilities are included. And in speech therapy, we focus on communication. So you all knows we have a two type of language. Some have receptive language and expressive language. So we focus on according to the child. You know, some child can vocalize, some can't. So we use a pictorial exchange communication system, augmentative and alternative communications, also the pictorial schedules, and we have a iPad which we use a program called Prologue, but it is I think internationally used, but it is in English language. But some child with a bright brain, they communicate with the iPad. And in occupational therapy, we focus more for fine motor, writing skills, area like dressing, brushing, and concentration and visual perception. Multisensory in Snoozle Room is sensory stimulation and behavior management and music therapy. So these are all the services available in SCRC, but we focus on the parents' needs. I said not all the children will get all the services, but the parents' need. Maybe parents' needs is, like I said, eating, then we focus on eating. So eating, the child will get occupational therapy, fine motor skills, or if the child with autism have a sensory stimulation, you know, we call test problem, then we go for sensory integration. And if the child needs adaptive equipment and all, then we develop the adaptive equipment for the children's. So some of the pictures. And in vocational training, so vocational department was established with the aim to teach some of the children become economically independent. The areas of vocationals are, so you know, after all this education, in mainstream education we give a child knowledge, then they can have a more knowledge, and in later future they work on the money. But in the areas of special needs, we make them independent, so they can do a simple thing. Even they can help the parents in household. They can be a productive member of community and home. So that's the skills they are getting. In pre-vocational training is 12 to 16 years. So we is focusing for making cards, necklace, bangles, growing flowers, herbs, and making candles. In vocational training is 6 to 18 years. So these are all the vocationals. So they will get on the money. And on job training is 18 years and above. So if the child is 18 years, we focus on the job. So I think in our country, it will take maybe 5 years or 10 years that the company, restaurant, simple offices will hire people with disabilities. Mostly the problem with the intellectual disabilities. So it takes some time for awareness, but we tries to give awareness for the people that the children with intellectual disability can do this job. So then after 18 years, we train them and we employ the some of our students as staffs. We are now trying to get a job placement for the neighbor community. So it will take some time for awareness. So this is some vocational training department. We also have our residence facilities. So our school, like working with the 17 years of experience, visiting different parts of Nepal, different schools and all, our school is disabled friendly. Disabled friendly resident facilities, and who they are in the resident, the students are from the different parts of the Nepal. The highlights of the resident facilities are disabled friendly living arrangement and quarters, 24-hour care and dedicated staff, and separate living arrangement for girls and boys. So as we talk about discussing about the COVID, so our school doesn't close. We only close for the students who are from the outside staff and outside student. So some of the staffs, our principals, some of staff, they stay at the resident. And during the COVID period, we provided for the 33 students, we provided the services. But those who are from outside, they have a little bit difficulties. Some went house, village, because they don't have job, lockdown and all. And children also get on regression. So I think after this, our festival is coming. So we'll open the school after 1 month. Then they will start services. So this is, I think, resident is one of the good parts. So we continue running the school during the COVID period with all the safety protocol. So student can't go outside, even staff can't go outside. One person have to go for all the groceries, all the shops, but he wear a PPE or all the safety guidelines, and no visitor from outside can visit the school. So this is a resident. We also have a workshop because as in Nepal, it's very difficult to get everything. So then we thought maybe we have to open the workshop. Then with the simple adapted things, the children in the village can get improved. There is a very less workshop who develop the necessary equipment for children with disabilities. So we make a disabled friendly furnitures like bedded in our center. For that sustainability is one part. So our school is more sustained because we produce everything whatever we need for our center by ourselves, like furniture we make by ourselves. If there's some chairs, special chairs, standing frame, adaptive equipment needed for children, we make by ourselves. And we also make equipment for the other children and other centers of the Nepal. We also did a repair and maintenance of all the equipment and mobility devices. Sometimes, I'll give you an example. You'll see some very fancy, very nice equipment, workers, and it will cost $1,000. So it is impossible to have for the children with disabilities in the villages. Even in Kathmandu, it's very difficult that parents can't afford. So what we'll do, we just take the technical ideas, what that things works, how it is made, and we try to make it with locally, with maybe it may cost like $50 or $60. So that's works of our workshop. So this is some of the products. And in the village, because of awareness, lack of services available in the villages, children lie most of the time because they don't have special chair, they don't have standing frame and all, and children will be more disabled. So with a simple chair, it will change the life of children and the life of mother also. because child is lying most of the time, he cry, mother have to feed like this, and children don't know what is going around, how many members, all he just looks at the ceiling. So with the chair, it will help him lot for his ADL, and for mother also is easy because she can cook the food while the children can sit and watch the mother. So a lot of changes in the children with disability with the simple equipments and tools. So in SARC, we also have SARC Farm, which are established with the objective of providing a communal and supervising living space for children above 20 years of age with intellectual and physical disabilities who are abandoned by their families. Here the children are involved in very income generating activities revolving around farming. So regarding the children's rights, like due to poverty problems, or like in earthquakes, some parents die, flood, some parents die, children are disabled, they are enrolled. And then we have a child protection center run by the government. He will take that children to the orphan homes, and orphan homes will say, oh, this child is a special needs, this child is not a normal child, maybe he needs a special center. So that's why some child we also rescue if the police or somebody wants to send the special needs children for special center. And we also get some of child from the orphan home. So the children who are already 20 years, they are teenagers. We don't have any rules, services for the children, adult children with disability. So we have this farm. So children with above 20 years who don't have anybody, they can stay in this farming house till their whole life. And this concept is one of the sustainability for organization, because the children are trained how to do chicken farming, goat farming, vegetable farming, and fruit farming. Buffalo farming is very difficult for them because they can't handle buffaloes. So they will have a product and they will give to the SARC school, and they also sell. Maybe from next year they will get an income. They will sell, and with that income they will get food, their dresses, their basic needs with that income. So that is the idea of SARC farming for the children above 20 years. So this is SARC farm. And we also have SARC Early Intervention Center that Surina already told. We have our center office, and then this Early Intervention Center office in Kathmandu. Last like 20 days before, we have very heavy rainfall. I think it was after 50 years, that's rainfall in Kathmandu. Most of the part is flooded. So in history, it's never happened in my center. It's up to the hip level. Everything was demolished. Everything was damaged in that center. And now because I don't like say, okay, I'll wait for 1 month and I'll make my therapy centers after 1 month. But what's the problem is parents, they already came from the different parts of Nepal. In this center, children with 3 years, 2 years with disability get services. So they already are far from the far place. They have to stay here in resident places. We also have a room for the mothers and children can stay. If mothers don't have any relatives or any place to stay in Kathmandu, they can stay. So we already open now with all our efforts team. We started everything. So it's going on. In this center, we established for children below the school-going ages who are diagnosed with disabilities. So in our education system, I think Surinaji also told, we have in government, the school student can go when he is 6 years. So in some of our government now working on providing early childhood education development centers. So they have a center, one room for the children below the 6 years, so they can get education, early childhood education. And then after 6, they can go to the first grade. So for disability, they are very, I think, no such center who will provide the early intervention. Maybe parents have to go to the clinic. So in clinic, they can go only 1 week, 1 month, and they have to go back to the village. And then mother have to do, the condition, I think in everywhere, especially in Nepal, mother have to go to field, looks for the family and all, and she don't have a time to take care of the children. So in this intensive services, main ideas is, if you have a disabled child in 2 or 3 years, if you treat it within 3 months and provided 3 hours therapy per day, they can reach some function, like maybe they are able to eat, able to walk, able to stand. Then they can go back to the village and they can join the schools, regular schools. So early intervention is very good, very magic. And the country like us is very good for the developing country. Instead of putting a budget for 1 year for therapy, you can have the same therapy treatment within 3 months. So each day you have to go to the clinic 1 hour, 1 hour, 1 hour. You have to spend a lot of money for one year. But this 3 months, within the 3 months, that child will get a 1 year services within 3 months. He shows a huge improvement. That is the idea of we already said for the children with cerebral palsy is like we included, it should be a category 1 to 5 years, and the treatment is 2 to 3 months. It is a high intensity goal directed therapy. So it's Fit Care for You. We said Fit Care for You. I have trained this 4 times in Netherlands, and we did 3 times research in our schools. So it shows short program is 60 to 90 hours, and more than 90 hours, the goal reach will be long lasting. So within 3 months, you will see a child will be functional in what the parents needs, maybe eating, drinking, or walking. So this is very effective for the country like us. Then the parents just have to stay for 3 months and go back to the village, and child will be more functional. So this is a main target of early intervention center. So now, even during the lockdown and this COVID period, with all safety measures that parents stay in our residence, we used to provided 12 children's. Every day we treated 12 children in this center. So most of the children are from villages, Palpa, Chiton, different parts. And we have, if like here, the parents, those who can pay, they have to pay certain amount, what we make profit or something, we keep extra. Or if some scholarship we have from some individual philanthropists or some organization, we keep it. So we provided for those very needed one, like with the disabilities, it's huge problem in family. Like some mothers are thrown from the family, she is single, she have to work as a labor, she don't have money to treat the children. So we provided scholarship for this type of children for these services. Then the child can be better and then can attend the normal regular schools. So that's objective of our early intervention center. So outreach services is, we also did outreach services because I already told you the skills we learned, and we have a partnership with different universities. So we have a professor who come here and train our teachers. So we like to share all our skills to the different government schools working with disabilities. So sharing the skills can help lots of disabled children in Nepal. So we train the teachers how to make a resource material, how to understand the different types of disability, making education plans, and how to make a local resource material. Like there are certain places it may take 3 days, 4 days from here, from Kathmandu. So we'll teach you can use a local material like this, so it won't cost. So that can be used for the education. So some of the training we did for the 5 district. And we also invited the teacher to the Kathmandu so they can see what are the services, what type of disabilities, how the vocational training is running, how the educational plan, how to make a visual schedule, all this, we train them. We also train the parents. And regarding the COVID, what we did, those who can't attend to the physically, we did virtual training. So mother will call, and she shows the child, okay, my child can do this. So what I can do next? Then we'll take other child as a sample and we'll teach them, you can do this at home. So we try to help the mothers to do some of the activities at home during the COVID also. And regarding the eating protocol, we also, this is a teacher from Humla. I think Humla, we don't have even reached the transportation. It will take 3 days from the Kathmandu. We have eating flowcharts. It was developed by the University of Netherlands, and our teacher are trained as a supervisor, and we develop it in the Nepali. It's also available in English and Nepali. And we train all the schools working with disabilities, especially with the physical and autism, how to make them independent. So we have a protocol flowchart, how to make the child independent in eating. So these are, after all this, there are a lot of things we have to improve in our country. Although much has been done in this area of special education, there still is more work to be done. Some areas where we think more intervention is needed and are struggling to intervene are like early intervention of children to prevent a life of disability in future. So I already told you, like, if you treated a children in early age, they won't be disabled in the future. If the child walks within 6 months or 3 months, he will be a normal child. He will attend the mainstream school. Is I think less resource the government have to pay, less burden for parents, and child will be without disabilities in the future. And vocational training for physical and intellectual handicapped children. This is lacking in our country. Empowerment and employment of people living with disabilities. Development of disability-friendly infrastructure and removal of architectural barrier in public, private resources, infrastructure like roads, building, etc. Development of skilled manpower to support people living with disabilities. Collaboration between different organizations to develop different teaching resources and methodologies. Developing disabled-friendly policies and acts, and evidence of acts discriminating people living with disabilities. So these are all the areas we have to address, need to address more. So thank you all. Hope you will get the services available for the special needs children in us. Thank you very much.
Okay, thank you very much. Right, you both, Surina, Guru, and Kalpana, your topic was the facilitate to special needs children for the holistic development in South Asian countries. Very wonderful lectures that you conduct now. Mrs. Surina, she explained because of the pandemic, the situation, how what are the challenges in reopening the schools and these things. Then Kalpana, she talk about facility of the service available in SCRC system, right? How it is actually very important that what you said, right? Because sometimes we also, our schools can apply in I have some questions, right, before conclude. Right, you mentioned the prognosis, right? It's a word I show. What is the difference between diagnosis and the prognosis?
So what we'll do is diagnosis, we have to diagnosis if the child come with the special needs, we have to diagnose what is his condition, because every conditions, every types of disabilities have different things. How to do handle with autism, how to handle with CP and all. So they have to go to for diagnosis. Diagnosis is needed. And some have to do, if they have the seizure, they have to go for EEG because it's needed. If their epilepsy problem is not solved, they can't improve. So diagnosis is needed. It will clearly shows what's the child have problem, how it will go and all. And prognosis is according to the severity of child. Like if the child will, now you look on the Facebook, some donation for spinal muscular atrophy, some muscular dystrophy and all, then you have to know what will be the prognosis. So now the changes is like, as you said, difference between diagnosis and diagnosis is, what's the condition of child's, what the problems he have, exactly the condition will get from diagnosis. And with the prognosis, that diagnosis will be a future handicap or he's able to do, that will tell the prognosis. So in prognosis, like you have to be like in before, when we read, in every booklet that it's written, if the child with cerebral palsy, he will be handicapped in the future. If spastic, he will be this type of protocol. But some we have to be evidence based. Like I told you, it's not written in the book what we studied before. If you provide a child early intervention, high intensity goal directed therapy, he will be near to the normal. He will be independent in life. It's not written. So for the prognosis, it will tell, we have to look for the internet and all to be progressive. And in some article, it will be written, if the child have physical therapy all, he will be independent in life. So that's difference between prognosis and diagnosis. So while working with the children with special needs, we have to diagnose everything, like their IQ. Sometimes, for slow learner, parents will tell, my child knows everything. He knows the direction, he knows how to cook the food, he knows everything, but why he can't study? And then we have to diagnose or find out what is IQ. So it's very important, diagnosis is needed, and which will tell the prognosis. So once we know regarding the intellectual disabilities, slow learner, once we know the IQ, it also gives us a clear idea what will be the prognosis in the future, his progress.
Okay, thank you very much. You are actually you have qualified the psychology counselor, the psychotherapist. Then yes, another question. According to your experience, right? You have the familiar with the countries, the students, and all that. Give me the short example of speech therapy you have done, and the,
Yeah.
music therapy. That's all my question.
Yeah, okay. So regarding the speech therapy in Nepal, so I'll tell you what is in the Nepal speech therapy resources, you know. Maybe in your country, you'll have a more resource person. In Sri Lanka or India, it's already education. So in Nepal, we don't have university training center for speech therapy. So mostly hardly 10, 12 speech therapists in Nepal.
No,
It's
no,
very difficult.
sorry.
No, speech therapy is program.
Example for how do you do speech therapy and the
Okay.
music therapy. That's only I want.
Okay. Okay, sorry for that. So what we'll do in our center, we like as you said, when the child is diagnosed, we'll have some checklist for the communication. So there is a checklist on the early childhood POTES guideline about the cognitive speech development from 0 to 5 years. So we'll assess the child, what is his problems. Maybe he will communicate with the eye, or he will communicate with expression, or he will communicate with the picture, or he will do the verbal. So we'll do the all the assessment. You know, there is a difference in the child with the autism and child with the cerebral palsy. So child with the cerebral palsy have more weakness on the mouth and tongue. So we in SCRC, we focus on strengthening the mouth muscles and tongue, because tongue is also a muscle. It has to move a lot. So then they started speaking. And children with autism and low IQ, we started with the gesture, facial expression, slowly with the real objects, so me this, slowly with the pictures. And regarding the music therapy, you said in the research source, music therapies gives increase a neuroplasticity of the brain. For us, when we are sad, we like to listen to the some calming music, some romantic music. Like in the morning, if we listen to the like Hindi song, I used to listen to the Kishore Kumar song, which gives us very nice moment for us. Like in children with disabilities, there are a lot of music lesson. We also have music department. So some child with autism, they likes to play, which will help to develop their cognitive and neuroplasticity. There are music, like when the child shows the tantrum, you can play calm music. And then the group music therapy is child in the group, so they will train how to do the group music, how to play a slow, how to play a hard, so it improves their coordinations, brain and all. But the research shows with the music therapy, it will increase the neuroplasticity of the brain. Like brain is already damaged, already underdeveloped. So the brain surrounding cells, beside the damage or underdeveloped cell, it increase the neuroplasticity. So brain capacity is improved. It is very helpful. So these are the things we did in SCRC.
Okay, thank you very much. That's very clear and sound. Thank you, both of you again, to participate this conference from Nepal. Right? Okay, thank you.